Hello, everybody, and welcome to the Lean with Leanne podcast, Confessions of a Diet Queen, episode 4. I'm really excited about today's episode because we are going to be discussing all things pre- and postnatal training, nutrition, and body image. Now, I know the science and I have the experience of a coach training pregnant people and postnatal clients. However, I do not have the benefit of ever being pregnant or having a little one. So I couldn't think of a better guest to have than my friend and client, the lovely Hannah Dillon. Hello.
Hello, hello.
Hi, how are you?
I am very good, thank you. How are you?
I'm good, thank you. How's lockdown 3.0 finding you at the moment?
The fact that it's called Lockdown 3 is pretty self-explanatory, I feel. There's been way too many of them, but we'll get there. We're all trudging along and the end is in sight, so it's
Yeah,
not great. But
we'll do it. Can't wait to get back in the gym. So, welcome to the podcast as my guest. You are the first of my clients to come on the podcast. So I'm really excited about that. And obviously, I wanted to get you on because you trained all the way through your pregnancy and trained post-pregnancy. So I thought it would be very handy to have you on to talk about your experience. But before we do that, how is that gorgeous little baby of yours, Molly?
my gosh, she is amazing. She's just turned 1 and I can't believe where that year's gone. I think any parents at the moment kind of feel a bit sad with what the past year has done for our little ones, but she's just been like our little rainbow in the storm. She's lush. She's walking and she's trying to talk and she's causing all kinds of trouble, but we love her.
Yeah, she's so cute. I certainly look forward to my little Molly videos throughout lockdown from when she was a little baby to now walking. I can't believe how fast it's gone. So,
I know.
we are obviously going to discuss your journey through pregnancy and how the gym helped you and benefited you and what your programming kind of looked like and how training changed for you and your nutrition. We're also going to talk a little bit about the birthing process in terms of your experience, and then talk about postnatal, what you're doing now, how training looks, and how you fit in your training and healthy eating with a baby and obviously in lockdown as well. But I do have to start obviously with a disclaimer to say I am not a midwife, I am not a doctor. If anybody is listening to this and has any sort of queries or questions regarding training or nutrition or anything to do with pregnancy or postnatal, then my advice would be to always check with your doctor first if there's anything you're worried about, or ask your midwife or health visitor before you do anything. And that brings me on to really the first sort of subject, in that when it comes to training and going to the gym and exercising when you find out that you're pregnant, I feel like there is quite a lot of people that fear working out. They become anxious about what food they can and can't eat. And there's not actually masses of information or studies on the subject, due to the fact, obviously, there are some ethical issues with putting a pregnant woman through her paces. However, there are quite a lot of NHS guidelines, and we'll discuss them in details as we go along. But I wanted to ask you, Hannah, when you first found out you were pregnant, did you have any anxieties about exercise? Because you were obviously exercising quite regularly before you got pregnant.
Yeah, I had all of the anxieties a lot. I think I was worried about every aspect. And the trickiest bit is when you initially find out you're pregnant. So for me, that was like 1 to 2 weeks. And then you have that like secret bubble time frame where you don't tell anybody. And that's probably the most anxious time. And you don't officially see a midwife face to face until you're 8 weeks pregnant. You can call and things like that, but actually having that sit down and talk to like a midwife about the pregnancy, that seems like a long time to wait. So for me, it was a decision I made quite quickly to tell you very soon, and that it was, purely for safety reasons, really. But I think it was like my 5th or 6th weeks. But even those first 5-6 weeks were so anxiety provoking, and you don't really have much proof that there's a little one like growing away in there. So the fact that your body's like protecting something so precious that you're not even aware of, the worry of doing any type of damage is just unfathomable. So yeah, huge amount of anxiety.
And I have to say, like, as a personal trainer, I always feel very privileged because in in the kind of bubble of people that you would obviously tell first that you're pregnant, I'm always one of the first ones to know. And I always feel
Yeah,
like sometimes I know before people's parents, people's grandparents.
yeah, yeah.
Yeah, I feel so
Yeah, like you
privileged.
pick you wee on the stick and you think, right, boyfriendly and boyfriend. No, God, gotta tell.
I love
But
that.
yeah, no, we hadn't told anybody, and you were like the first person for a long while, but for obvious reasons, because I needed to make sure that I was safe, and you were the best person to give the advice. So yeah,
And I literally remember because I've got a bit of a like sixth sense when people get pregnant. And I remember one Tuesday before Body Pump, you were like, "Oh, I'm not feeling too well, so I'm not going to be there this week." And I was like, "I smell a
yeah,
baby."
and that I was coming. I think up until I fell pregnant, I was coming to the gym like 5 days a week. And so in those, because I was so anxious, I'd be like, oh, I just can't go because I just don't know how I would like hide it or if I do the wrong thing. So a couple of times I just like drop off a really lame excuse about why I couldn't go. But it is just, you know, just trying to protect yourself a little bit because it is a really scary time. But the minute you talk to someone about it and get the advice, all that goes because you know that you're fine and it's safe and it's
Yeah.
hard.
And, one of the main things I want people to take away from this podcast is that it is safe to exercise when you're pregnant, and that yes, it's going to change, and the most important thing is to try and get your mindset around the fact that your goals are going to change. So you may have previously been training for strength or for weight loss or to train for a run, but your goal is now going to be about conditioning your body to become strong, to cope with a baby and grow a baby safely, and to make sure that mum and baby are as healthy as can be. Was that tricky for you to kind of shift your mindset from your previous goal to now, hang on, I can't train like that as such? I'm going to have to mix a few things up to keep my baby safe.
Yeah, like you said, like I think the year leading up to me being pregnant was almost like a bit of a fitness journey for me. Like I'd lost a bit of weight and I was happy with where my body was. So then it was really focusing on what I could do physically. So you know, challenging myself with lifting heavier weights or even things like working towards doing pull-ups and stuff like that. It was all very physical. What am I capable of doing physically, and like pushing that each week with you or in classes and things. And I think I found it hard because I'd been used to pushing myself in that way, that just having to pull back on the reins a little bit. And I would have sessions with you where maybe I wasn't feeling as strong as I normally did, and I would have a little cry because I felt weak. But then I think once you see your body changing, you get more of an acceptance of, all right, okay, so this is what's going on. I do need to just be a bit more mindful. So, and the feeling of being able to nourish your body like that and know what's going on inside, and the fact that you're doing these things and being active to really cater for it is so lovely. But yeah, it was really hard shifting from like that physical like challenge and like pushing myself to more pulling back and actually just thinking, what do I need to do to keep my body healthy.
Also, did you have any worries or concerns about the way that your body was going to change? You've said like you had trained and you were happy with your body and you'd worked really hard and you were getting stronger and fitter. And then all of a sudden you have to sort of accept that, okay, my body is going to change because I need
Mm.
to grow this baby. Was that hard for you to get your head around?
Yeah, it was hard. And I think I'm a very similar background to you. So since being a teenager, my focus has been like, you need to lose weight, you need to be slim, you need to like look the best that you can be. And that was always kind of like a little chip on my shoulder, a little niggle in the back of my head. So knowing that my body was going to change again took a lot of getting used to. But I think again, it's that funny first trimester. So for me, I didn't really get a bump properly until after the first trimester. I just looked like I'd eaten a couple of roast dinners, which I hated that feeling. So like, you feel a bit of a podge, like your clothes a bit uncomfy. And then, if you're someone who's been like us in the past, your brain then goes into overdrive of, oh God, I can't
Yeah.
feel like this. Like, it's not good. But again, once you get that bump or you feel the baby moving and kicking, then it's like, wow, my body is doing amazing things and I need to just appreciate it. But again, it's that first trimester. It's so tricky. But yeah, that was really hard, because it's almost like we've been conditioned to think that like slim and thin and toned is best, and pregnancy doesn't look like that.
No, and I remember you having the cutest little bump as well. I remember it was so sweet. There is sort of like, I find, a generational opinion that pregnant women should not train or exercise, or overexert themselves in any way. The age old kind of comment like, oh, you shouldn't be doing that, you're pregnant. Was that something that you found you came up against? I know it obviously comes from such a loving, good place and people just want to
Yeah.
protect you and protect your baby, but did you find that was something you came up against with people?
Yeah, I had it like almost in two prongs, really. So first, it was like my nearest and my dearest, like my family, my loved ones, and it was just exactly what you said. It was just that worry that they wanted to wrap me up in bubble wrap, and they just didn't want me doing anything that would, cause any kind of trouble. But the other side of things were people who just didn't relate to the lifestyle that I had. So like spending 5 days a week in the gym, like eating like well and thinking about nutrition and stuff like that. So it was those people that were really judgmental and almost made, it was kind of like, well, if you're going to the gym and you're working out, you must only be doing that to lose weight. And whilst you're pregnant, oh God, that's horrific. So I would get a lot of like, you need to take it easy. You're burning the candle at both ends. And I did all that, I had like my feet up on the sofa and foot rubs and all that, but it actually being active for me made me feel even better in my pregnancy. So yeah, I had a bit of the love and the bubble wrap kind of people, but then I had like the I don't even know why you're going to the gym anyway, and to do that when you're pregnant is horrific type of people. So yeah, that was difficult.
It's funny that you say that because before I started training prenatal clients and I was learning more about it and did my qualification, I always assumed as a coach that if somebody had come to me and they'd just got pregnant and they wanted to start training, that it should be my responsibility to say, oh, you have no training background. Actually, you shouldn't be exercising. But I think it's really important to say that actually it's very beneficial to start having an active pregnancy for a number of reasons, which we will go into in more detail. But also that it's very beneficial to have a personal trainer because kind of like alleviates a little bit of the responsibility off of your shoulders, because you should be seeking the help of someone who does know exactly what you should be doing to benefit you, benefit your baby moving forward. And actually, there is no risk of premature birth, low birth weight, or fetal distress with exercise as long as it is done with correct and safe form. And I think that's really, really important. So I think a lot of people will probably get the same pressure that you got, that they shouldn't be exercising, they should be taking it easy. But actually, there is absolutely no risk of premature birth, low birth weight, or fetal distress, providing you are doing an exercise routine that is safe and effective for your
Yeah,
pregnancy and
I
baby.
think what all they're seeing is from their point of view, they're not seeing the fact that I'm doing it with the heaviest guidance. And actually, most of the time, I'm doing it with someone like right there next to me, watching exactly how I'm moving, how I'm holding my body, how I'm supporting myself. So it's much more than what it seems on the surface.
Yeah, it's totally true. And in fact, an inactive or unhealthy pregnancy can actually lead to excess weight gain, which we know as women is not the most confident thing for us to have anyway. And it's totally unnecessary during pregnancy to have excess weight gain. It can cause gestational diabetes, an increased risk of having a C-section, huge lower back issues, and incontinence. So being active through pregnancy is actually very beneficial to mum and baby. However, just because you exercise, and I think it's important to say this, especially in relation to your story, Hannah,
Yeah.
is that just because you exercise during pregnancy, that does not guarantee that you will have an easy, smooth birth. The birthing process can depend on so many different things, including the shape of your pelvis, your genetics, as we will find out when we discuss your birth with little baby Molly. But what I did want to discuss was, if like Hannah, you are somebody who has always trained or loves their exercise, loves going to classes, then you will obviously know the benefits beyond physical of exercise, you know, the community that we have when we meet people in our classes and in the gym, mental health positives, cardiovascular health, strength retention, and all these are so important, especially when you're pregnant. Did training during pregnancy have a positive effect on your mental health?
Yeah, massively. I think, you know, from the get-go, pregnancy throws all these different types of emotions at you. You know, it's overwhelming, it's daunting, there's a lot of dread, there's a lot of excitement, there's a lot of anxiety, and I think that that can be for any women across the board. And I think for me, exercise was a mindful thing. So when I was exercising, you have to be in the moment, because you're focusing on what you're doing there and then. You haven't got time to cast your mind ahead and think what if and ruminate and, you know, mull over things, because you're focusing on something in the here and now. And that's not to say that exercising vanished the worries, but it gave me those set times in my day or set times in the week where I could just give my mind a little bit of a rest, because my body was being active and almost like taking over and steering the ship. So yeah, it did have a huge impact on my mental health, and it still does.
And I think also it is important to add in here that even if you are active prior to your pregnancy, obviously there are people that really struggle with morning sickness all through the day. And I'll take one of my other clients, for example, Amy Savage, very active girl, loves to train, but was so sick during pregnancy that she literally had to spend the majority of her pregnancy lying down in a dark room. And I think in those instances, it's important to say that every pregnancy is different, and this podcast is not designed to make people feel guilty if they can't be active, because if you are in a situation where you are having horrendous sickness, then the priority is just to try and keep yourself and the baby as safe as possible.
Yeah.
Did you ever suffer with morning sickness?
I hate to like shout about it, but I was really lucky in that I didn't suffer with a day of morning sickness, which is probably horrific for some people to hear. But for me, it almost that had a damage on my mental health, because I had zero pregnancy symptoms apart from a couple of lines on a stick to start with. So for those first 12 weeks, I would drive myself crazy thinking, am I, aren't they? Are you still there? Or what's going on? I don't know. To the point where I think I took a pregnancy test like every day. It was mad. But so some days I would will some sickness just so that I know that something was going on there. But I can't imagine what it would be like if I did feel, I mean, I know, you know, the friend that you're talking about, and for me, not to be able to exercise because of sickness or symptoms would have such a detrimental effect, I think. And I would really struggle with that. You know, it was really nice that I could feel like, look, I'm being productive. This is what I'm doing to my body. I'm really looking after it. And, you know, that really helped being active. And I think if I couldn't do that, I might kind of slip into that, oh, well, you're eating for two. And, or, you know, some people say, well, I'm pregnant. It's the only time I'm allowed to be fat, or I can just like sit on my backside all day. And I think for me, that would be a really bad mindset. It was just good in keeping me going. So I don't know how I'd manage if I had that level of morning sickness.
Yeah, which brings me on to my next question, which was, do you think if you had been unable to exercise during your pregnancy that it would have affected you in a negative way?
Yeah, I think it would have done. It gave me a bit of a focus as well. You know, it can be, it's a difficult time because sometimes, you know, especially in those early days, it's quite lonely. I haven't really talked to anyone about it. So it's really good to have that focus and, you know, have something you can do. But again, keeping your body moving and your mind busy. And yeah, I think it just helped me feel like I was really doing my body good.
Just in case there's anyone listening to this podcast that does suffer with really bad sickness, they call it morning sickness, although from my experience in with my friends, it's kind of like all day, all night. Some of the interesting facts that I read about morning sickness was that if you are someone who suffers quite badly, that actually it is a good sign, which I can understand. If you were reading that and you didn't have any morning sickness, you would definitely go into panic mode, yeah. Because it means that your body is having such a large surge of hormones to grow your fetus that it actually means you're at less risk of having a miscarriage. And there are also recent studies saying that there are connections between suffering with morning sickness with a reduced chance of getting postnatal depression. So that was really, really interesting. Some tips that I have read, I have obviously never had morning sickness, but some tips I read was ginger biscuits. I think that's a proper old wives' tale, isn't it? Ginger biscuits for morning sickness. And eating them in the middle of the night. So on one podcast I listened to, they were saying that in the first trimester, you find that often you're up in the night a lot needing a wee. Is that true?
Yeah. Yeah.
So on your way back, have a couple of ginger biscuits, because one of the main causes of morning sickness is because you are hungry in the morning. Your hormones affect your nausea. So that might be one tip. But obviously, if it's really bad,
I have friends who used to say that they would just bring like a whole hoard of snacks and just keep eating little and often all through the day, just to like keep it at bay. Which seems strange because when you feel sick, surely the last thing you want to do is eat. But...
yeah. And dry toast seems to be like the number one diet for morning sickness. Okay, so let's get right into the grittiness of it and talk about training and how we adapted your training, Hannah, while you were through your pregnancy. So as a coach, when somebody comes to me and says, I'm pregnant, then I know there are certain areas that I need to work on to help facilitate the growth of a baby and to help with certain positions and strength that the mother is going to need moving forward once they've given birth. And a couple of things to note are that I would typically, and we did with Hannah, work specifically on building strength in your posture. So through pregnancy, obviously, your boobs grow because they are getting ready to produce milk and therefore they become heavier. So we did a lot of things like lat pull downs, face pulls, banded pull aparts to help strengthen the upper back for the growing of your boobs and also for the fact that you're going to be carrying a baby after birth and to reduce your back pain. I also would program a lot of glute work because weak glutes can affect the position of the pelvis, which can increase lower back issues when you're pregnant. Because obviously, if you imagine you've got your bump in the front, it weighs quite a lot. It's going to put a lot of pressure on your spine. But disclaimer, you would never do any glute work with a barbell. So no barbell hip thrusts or glute drive because you don't want to put too much pressure on the abdomen where the baby's growing. So if you remember, Han, we did lots of kettlebell squats with the glute band, and we often used the fit ball to take the pressure off your lower back. We did loads of sumo squats, wide leg presses, etc. Was there anything else you remember that really helped you during your training moving forward with growing your bump, etc.?
I think there were just loads of little kind of tweaks and things that were really useful. So that I wouldn't say, apart from like anything that meant resting on your bump or lying flat on your back, there wasn't anything that was completely off the cards, but it was just making little tweaks and things. So when we were using the bar kind of like up over our heads, when the bump was getting a bit bigger, we swapped them out for dumbbells, which was really easy. I had more mobility and it just meant I could protect my tummy. Again, like if we were doing chest exercises, some of them you need to lie flat on your back. So I would just set the step up like at a bit of an angle to relieve that pressure. When I was very first pregnant, I used to casually drape my hoodie over it because I thought no one would notice. I was lying at an angle.
I always say you always find out if a body pump is pregnant because they've got to put their step up high on one end. And I remember Laura being pregnant and she was like, oh guys, I've just got a bad back. And I was like,
yeah. And you used to say in the classes, so anybody with a bad back, you need to do this. And I'll be like, right, got it. Yeah, that's me. But yeah, things like I used to do like the squats, for example. I used to actually stand like on a big weight. So my heels were elevated slightly to help like with my glutes and things. Even I did suffer with a little bit of dizziness. So some exercises, instead of like standing and bringing things over my head, I used to just do it on my knees or sat on the bench, which just kind of gave me a bit of stability. And I remember doing like a few different ab exercises, which you would think would be a complete no-no, but it was just ones that were tweaked and tailored. One was almost like a bit of a cat pose, where you kind of like moving your body in a certain
Yeah.
way just to like tighten up ab muscles, but the different time. You know that better.
Insert science here.
Yeah.
Yeah, so one of the reasons, I'll start with the bench being higher on one end in pump. Body pump is a very high rep endurance based workout. So you're talking like 5-6 minutes of continuous reps. So when you're pregnant, obviously that elevates your heart rate and your body temperature. And the reason why you have to elevate one end of your step is because when you are doing a lot of reps in a bench press position or a push up position or something, you are effectively raising your heart rate and therefore reducing the amount of oxygen that goes to the fetus. And if you then accompany that with lying on your back, you're going to reduce that amount of oxygen even more. So if you set your bench at an angle, that helps just provide a little more oxygen to the baby while you're training. So that's why we do that. It also helps support the lower back a little bit more. There's not too much pressure on the bottom of your back. But also, yeah, we changed out the barbells for the dumbbells so that you had a little more freedom with the range of motion through the weights. But in terms of body pump, you pretty much kept going all the way through, which was very impressive.
Like till the day before I went into hospital.
Yeah. Oh, yeah,
Yeah,
it was, wasn't it? The day before.
it literally was. It was a Thursday, and I went in on the Friday. But I think what's good about body pump is that you can pace yourself. You can adjust things as you go. So if I was having a day where I was feeling a bit, I would just lift heavier weights or just do body weighted things. You know, I think that's what I found really useful. It's not all like heavy go go go. There's so much flexibility.
Yeah, and also a couple of other things to remember is core temperature. So Hannah would always strategically place herself right at the back of the room where the aircon was, and we'd open the windows. And what you have to make sure when you're training as a mum is you can get really quite hot and bothered. And I always say to anybody that's pregnant and training, like, nobody knows their body better than you do. So you just have to really become mindful of how you're feeling, what your heart rate is doing. You never really want your heart rate to go above 90% of its maximum output. Because if you think from a science point of view, what your heart rate is, your fetus is roughly double or 3 times the amount of that. So you don't want to be doing any type of exercise where you're really kind of gasping for air. What they say is there's a scale called your perceived rate of exertion, and 10 being like, crikey, that is a really hard workout. I can't get my breath. I can't speak. I'm really sweating. 1 being hardly anything. You never really want to go above 8. And obviously, depending on your fitness and strength, each person's 8 will look a little bit different. But we used to stick Hannah right at the back so that she had constant cool air coming from the aircon, ventilation from the window. And we just used to say, like, if you get hot and bothered or you feel like you're feeling a little bit, just sit this one out and get your breath back, etc. Because it's really important to keep you and the baby healthy.
Yeah.
I do remember you struggling a little bit with a bit of dizziness, especially when we would do like weights from the bottom to the top and like shifting the weights around. But other than that, I think it was pretty plain sailing, wasn't it, with you?
Yeah, it was. Yeah, it was. Nothing.
Yeah. And like I said, you know your body, don't you? So the minute you feel like I don't feel right, it would be a case of I'm going to lower the weights and sit this one out.
And like you were saying, one person's 8 might be different to someone else's 8, but actually for yourself, one day might be an 8, but another day you can only manage a 5 or a 6. Like, I think pregnancy throws all those different things at you. So not every day is the same. So I think you've got to relax a little bit on the pressure you put on yourself too.
Yeah. And I always remember my friends and yourself talking about the level of fatigue. Like, as soon as they found out they were pregnant, their energy levels were just in the basement some days. Like, did you experience that as well?
Yeah, not as much as I thought I would. But again, I wonder if that's just, partly because I had been active and kept it going. So it's almost like continued riding the train. I think maybe in the evenings I would, but it didn't really impact my training too much. So, but again, I think we were just good at taking each day as it came and, following my body's lead.
The guidelines for exercise and during training can be found on the NHS website. But what I think is really important to say is that everybody talks about how an active recovery has absolute huge benefits on post baby and post birth recovery. So the ability of your body to bounce back after going through what is effectively a large trauma of giving birth. And exercise also promotes, as we know, the production of all your happy hormones, such as your endorphins, serotonin, and dopamine, which help improve the mood and energy levels of both mum and baby. So, do you think that being such a strong and active person all the way through your pregnancy helped you recover post birth?
Yeah, massively. And I had a C-section, which I wasn't expecting. And the recovery from that was seamless. And again, it could be coincidence. It might just be that that's how my body handled it. But it really went without hiccup. And I had pain for about a week, but that went quite quickly. I was able to be quite mobile. Obviously, was careful and took all the advice and things, but I had no complications. It just, in that respect, like the healing and that side of things, it really did kind of go quite easily, And again, not everyone's that lucky, but I'm hoping it's because I, took good care of myself and just kept active. But,
Yeah, and also if anybody is newly pregnant, which, by the way, one of the reasons why I'm doing this podcast is not because I'm pregnant. I'm not. Before anyone starts saying anything,
don't do that.
I'm not. But every time I do an 8-week challenge, every time since the first 8-week challenge to this 8-week challenge, every time after 1 week, 2 weeks, somebody ends up getting pregnant. I don't know if it's because everyone gets in their mojo, they start eating healthy and feeling sexy, and then bang, Leanne, I've got pregnant. Like, here we go again.
There was someone recently in the past few months, and it was so heartwarming, and that she'd been trying to fall pregnant for a long time and couldn't, but because she had got into the 8-week challenge and got herself healthy and got herself fit, they'd finally fallen pregnant. And I remember a friend saying to me that she found pregnancy and things really, she managed really well with it because she'd got into her best shape before falling pregnant. Yeah. And I think there's definitely something to be said about that, isn't it?
Oh yeah, 100%. But if there is any newly pregnant people out there, then I think it's really important that if you are worried about training, if you get the go ahead from your doctor or your midwife, there are so many benefits post baby. And I'm not talking about getting back into your post baby body, because I think there's a lot of pressure on mums to do that, and it's unnecessary to rush that. But in terms of the recovery process, especially if you end up having a complicated birth and you have to have a C-section, the stronger you can make yourself before you have that baby and you give birth, the better you will recover. And that was definitely true with you. And I just want to go back to how you said about core training, because this is an absolute minefield, because there's so much misinformation about training your core when you're pregnant. And I think the majority of people immediately think, no, I shouldn't be training my core. And there are certain things that I would not advise somebody to do, based on the fact that you are going to have to allow your stomach muscles to stretch and to open up so that your baby can grow. But you do fundamentally need an extra strong core, because you are about to grow a much heavier weight in the front of your abdomen. So there are a lot of things that you can do in order to help. And also your core, I think a lot of people think just means abs, but it doesn't. Your core literally wraps around the whole of your body. It includes your obliques, which are your waist muscles. It includes your transverse abdominals, which are like a seat belt of muscle that go all the way around your body and attach in around your lower back. I would include glutes in your core as well. And we did a lot of core work. Mostly we concentrated on like planks and stuff, didn't we? And we were really, really strict on form, which is the most important thing. So, for example, when you're in a plank position, you imagine if you're, in your second or third trimester and you've got your bump, your lower back is going to start to feel the strain because you've got this additional weight in the front of your body. So with Hannah, we just made sure that she was always tucking her pelvis and really actively working on getting her spine neutral and being strong in that position that wasn't putting too much pressure on her back. Did you suffer much with your lower back?
Not really. No, I didn't. And it was interesting that you're saying about core, actually, just like going back to that, because separately to your classes, I actually went to a yoga class, just like a one-off class, thought I would try something different. And it was really funny because obviously, like yoga, there's a lot of balance, so it's a lot of core like based work. And I think the instructor was a bit petrified when I walked through the door, like with this big bump. And it was very much like, you can't do that, no, don't do this, and it really restricted the class. But I think maybe that was her confidence in knowing what I could and couldn't do, because actually there's, you know, I knew from you there was so much more I could do. So I think it is really good just to get the proper information before either you set to it, before you rule it all out completely, because there is a lot that you can still be doing.
Yeah, 100%. And when I was doing my research specifically on prenatal core training, they the studies were saying that it's actually more important to, rather than focus on what you would do to tone your abs like sit-ups and crunches, that it's actually better to resist against something in the different motions that your spine can do. So I'll list them for you. So your spine can do flexion and extension, so bending forward, bending backwards. It can do lateral flexion, which is bending to the side, and it can do rotation, so it helps you rotate your body. And what you want to do is perform exercises that resist against them. And what I will do is I will post a link in this podcast to some videos of exercises that you can do if you are pregnant and you want to work on your core. There was a lot of advice saying stay away from too much flexion and extension, which would be your sit-ups and your crunches, because there is some studies that say that can being the word, lead to a greater risk of something called, and I can never pronounce this word, diastasis rectus. I don't think that's how you say it, but it's something like that.
Good.
Yeah, and it's basically when your abdomen wall, so your six-pack abs, it's like they kind of split to allow your baby to grow, and then they never go back. So you end up with kind of like a ridge down the middle. And too much flexion and extension could have an effect on that. But again, it's probably down to a number of things like your individual anatomy and your genetics and the strength of your core. But this is another reason why you want to focus on having a strong core during pregnancy, so that you're more likely to recover and those abs are more likely to go back and be strong once you've given birth. Did you have any issues with your abs post-pregnancy, other than obviously you had a C-section?
No problems. And actually, I found that they like appeared much sooner than I thought they would afterwards, because I'd spent all that time before, you know, being pregnant, building my body and working on, you know, my like physique and stuff. That actually, I think because I've done that foundation work, it had a better outcome at the other end, and that's kind of without trying too much. But no, I didn't have any like separation or anything like that.
That's the deal, isn't it? And I think as well, because you trained with me before, I am, as a coach, really hot on core training, because I think a lot of people don't actually perform it correctly. I think a lot of people use their lower back anyway, regardless of whether they're pregnant or not. And I think people just standard do sit-ups and crunches and perform planks with not the best form. So I'm quite hot on correcting form anyway. So I think a lot of my clients who come to me already have built a strong core. And obviously, if you had one post baby, that might be why.
Yeah.
I think another important thing to talk about is pelvic floor, because I think there's not enough information about it. I think it's still a very important muscle that needs working. And is very beneficial to start doing as soon as you find out you are pregnant. So I have to give a shout out to my husband's niece, Robin Bearton. She is a midwife. She contacted me as soon as she found out you were coming on my podcast. And she said that I had to tell everybody that you have to train your pelvic floor, because it's so important, because post-birth, if you have not trained it, it can lead to incontinence and lots of complications. So when I was trying to find pelvic floor exercises to discuss, she pointed me in the direction of an NHS app called Squeezy. I think it's about £2.49, and it has lots of different pelvic floor exercises. But one of the easiest things you can do, And one of the most memorable things you can do, and shout out to John Ellery for giving me this one, is every time you go to the toilet, which will obviously be a lot when you become pregnant, is trying to stop yourself from weeing. So when you're on the toilet, halfway through your wee, try and stop yourself, squeeze your pelvic floor, see how long you can hold it for, and then go again. And that's one of the easiest ways to train your pelvic floor. And I guess a personal question, Hannah, did you have any issues with your pelvic floor? I guess you didn't push her out, did you? So you were all right.
No, fail the C-section.
Yeah, she came out the car roof.
I know. A lot of people do, joke about, oh God, I can't bounce on that trampoline, or don't make me laugh too much. But actually, that would be a really horrible problem to have to put up with. So, I am lucky that wasn't the case.
Yeah, and I think that pelvic floor exercises are important anyway, because they are still an intrinsic part of your core. And yeah, I don't want to be laughing and wetting myself anytime soon. No. When it comes to exercise, I also wrote down here that I wanted to specifically say that thinking about the bigger picture in terms of your life, your training life, is really important for newly pregnant women. So I know maybe if you are someone who's started an 8-week challenge and then you found out you're pregnant, then you might feel a little disheartened because you had goals and you wanted to achieve something maybe before you had a baby. But what I have to say is, like, this is a small snapshot of your life, and you won't be pregnant forever, and it's a beautiful, wonderful, amazing thing. It's a miracle in my opinion. So realistically, thinking about your training goals, thinking about, when you are exercising and what your goals are, whether that's fitness, strength, aesthetic related, it's important to know that, the 9 months you're pregnant and then your post-birth is a small part of your life. So stressing out about your exercise regime or your weight loss is really unnecessary, and you just need to kind of take the stress and the guilt off yourself a little bit, because it's obviously not forever. Did you have any sort of like anxieties or issues post-baby about how quick, you felt pressure to bounce back to your post-baby body?
I thought I would put a lot of pressure on myself because, again, like you, like having that history with like dieting and, wanting to have like a certain body like image in mind. I thought I would put a lot of pressure on myself to do that, and really didn't want that to be the case. But I think when when I came out of hospital and when I looked in the mirror for the first time after, the last time was with a big old bump, and, looking in the mirror for the first time, I couldn't help but think, oh my goodness, look what that body has done. And it wasn't perfect, and maybe things weren't quite where they were initially, but the fact that your body has just transformed itself and housed this, this little mini human being, I just think there was more of I think I felt a bit more confident post baby, which I didn't think I would ever say. So I don't think there was as much pressure like I put on myself. It was really interesting because, after I kind of gave birth and had like my recovery period and stuff like that, I did start kind of getting back into exercise again. And I did one of your 8-week challenges, which is really useful just to help me find the balance of, right, I'm a new mum, but I want to work out how can I make that work. And, so I put like the work in and gave it the time. And a lot of people say to me, oh, you're so lucky that you snapped back. And I felt like saying this isn't luck. This is like 2 years worth of effort. And actually now I'm almost starting to, get back on my training journey again. So yeah, I didn't put any pressure on myself, but I think you have to be mindful of the comments you hear from other people, because I just don't think they have the same understanding. And again, they haven't seen where you've come from and where you're going. So yeah, I think I gave myself a bit of credit. I was a bit lighter on myself than I thought it would be.
I love that. And I think so many more mums need to give themselves credit. And do you know what I mean? It's like a newfound appreciation for actually how strong your body is and the amazing thing it has just gone through and produced and grown. And, that should light a fire in mums' bellies. Like, look what I can do, look what I can achieve. I've done this in my body. And
Yeah.
I think it's just a complete testament of how strong that your body is. And the fact
Yeah.
that, yeah, I totally agree with you. That was 2 years of hard work. You just didn't pop out your baby and wake up and was like back to normal. You put the
Yeah.
work in before, during, and after. And
Yeah.
people don't
Yeah.
see that, do they? They just
No.
assume that it's naturally happened that way.
Yeah.
One of
Yeah.
the other things we had to be very mindful of when Hannah was training was her mobility and flexibility. So when you become pregnant, you have an increase in a hormone called relaxin. And what that does is allows, especially your lower body, to relax more and to have a greater range of motion through your hips, through your knees, ankles, all your joints, in order to allow your pelvis to open up to obviously give birth. So as a coach, I know that when Hannah's doing a kettlebell squat, I have to be very mindful that her knees are tracking in the correct position. She is keeping her range of motion to what I want it to be, so that she's not putting herself at risk of opening up her hips too much, because her body is allowing her to do that. So we had to really focus on that.
And
Was
it's
there?
funny, like I was going to say, it's interesting that you say that, because I like historically suffer with a problem with my hip, which means like things like squatting and stuff is really difficult. But during pregnancy, I was thinking, oh my goodness, like look at me, I was like squatting better than ever. But you were like, whoa, hang on a minute, like let's take it back a bit. And I think it was like those hormones and things that were just allowing my body just to go that little bit further. But at the same time, you were on guard to just make sure that I didn't overdo it when I was getting a bit carried away, because it's
Yeah.
normally something that I would really struggle with.
Yeah, and I think it was really interesting to see your body change in that way. Um, so yeah, if anybody is newly pregnant, I would advise, regardless whether you're doing weighted exercises or body weight exercises, just be really mindful of your form, because this is actually a great opportunity for you to spend the next few months nailing the form in all of your lifts and all of your exercises, to make sure that when you do go back to training, like you were before you were pregnant, you have an improved knowledge of the positions your body should be in. And just be very mindful that you will suddenly be feeling a little bit more flexible and a little bit more mobile, but that is because your body is preparing for birth and because you've got an increased level of relaxin hormones. Was there any tips or tricks you used during training or classes that would help you feel comfortable during a workout?
I think probably a lot of the things that we talked about before. So, like being mindful of the bump when you're using the bar and swapping out for different equipment was really useful. Um, Even things like sometimes if we were doing kind of any work, I might like roll up a mat and put it under like my lower back just to put a bit of protection in there. Altering the bench, like we were saying, so it's elevated. So it wasn't anything astronomical, and people wouldn't look at me and think, oh my goodness, she's doing something completely different because she's pregnant. It was just kind of tiny little, like little tiny tweaks that we
Yeah.
made. Yeah.
Yeah, definitely. And we used fit balls and stuff
Yeah.
like that to allow to take the pressure off once the bump started getting big. I
Yeah.
think we've covered all things training, I think.
Ooh.
So let's move on to nutrition. So I think this really interests me, nutrition when you're pregnant, because I think a lot of people fall into the trap of, I'm pregnant, I'm eating for two. And technically that is kind of correct, because you do have another living being inside you that is going to need nutrients and energy, and that is going to come via what you eat. However, I think when you really logically think about it, you have to really think, well, in my first trimester, how big is this living organism? It's probably the size of like a little pea to start with. So what I'm going to start with is the actual information you need about your calorie increases, because I think a lot of people fall into that trap and then they struggle post pregnancy because they've gained so much weight. So technically, being pregnant doesn't really mean you're eating for two in terms of you don't need double calories. And actually, in the early stages of pregnancy, the number of extra calories needed is minimal. Sorry to ruin your life. The average weight gain is around 12 kilos, and in trimester one, you only need 90 extra calories a day, and that is
Wow.
like hardly
What's that
anything in it.
equal to?
I mean, a,
Like an apple and a half?
yeah, an apple, probably like an extra little apple. Yeah, it's not much at all. So
Oh.
you imagine if you're like, yes, I'm pregnant, I'm going to eat everything, you're going to put on quite a lot of weight in that first trimester
Mm.
when it's actually not necessary. And then in your second trimester, it's around 280 calories extra to your maintenance calories. And in trimester three, it's around 450 calories. 450 calories, because that is where obviously you have like a pretty much fully formed human being inside your
I
womb.
think in that third trimester, maybe this is wrong, but I'm sure babies grow at like half a pound to a pound a week, something crazy like that. Like their biggest growth spurt is in that last,
Yeah, so that would
last,
make sense that you need a larger amount of
yeah.
calories to accommodate for that. And also for the fact that if you are breastfeeding, or even if you're not, your body is still preparing you to breastfeed. And I think it's important. I have a lot of mums come on my challenges that are breastfeeding, that you still need to have additional calories post birth if you are breastfeeding, because you are producing a very nutrient dense nutrient dense milk in your breasts. So you still need to have roughly around 450 calories on top of your maintenance if you're producing for your baby. And that's because, like I said, breast milk is very calorie dense for the sheer fact that it's the only nutrients that your baby is going to be getting. They grow at a ridiculous rate after birth and in the last trimester, and also biologically they sick most of their milk up, so it has to be highly calorie dense in order to accommodate for that fact. Did you breastfeed, Hannah?
I did for like the first few days, but when we hear a little bit about my birth story, it'll understand why I didn't carry on.
Yeah. Did you struggle with any element of your nutrition during pregnancy?
I think, like I was saying before, when you find out you're pregnant, you don't actually see a midwife face to face until you're 8 weeks along. And I don't know, maybe it was me or just being in that bubble of, oh my goodness, if I talk about it, then it's real. So I was hesitant to phone up for advice. I did a lot of self research, and the NHS website is amazing, but sometimes if you look in a couple of places, you're going to find a couple of answers. So
Yeah.
I think for me, it was like stressing out when one place says this and then another says that. So I think really I should have just rung someone and asked and found out for sure. But I think it's in that you're almost like protecting yourself in that little bubble for those first few weeks. So it was just kind of funny things I was reading online, but then didn't feel I could check with anybody. And obviously, for years I had, maybe my diet was focusing on a calorie deficit because that's what I did it in training if I wanted to lose weight and things. So shifting that mindset and actually thinking now I need to add calories, I think mentally it was a bit like, right, okay, so I need to be doing this now, which
Yeah.
felt really alien. So I think that side of it felt difficult, but because for a long while I'd been used to looking at nutrients, eating the right things, eating a balanced diet, that part came quite easily to me. So it was just the little nitty gritty things that I found hard to get solid, clear information on.
Because there are a few foods that you're not allowed, aren't there, when you're pregnant?
Yeah,
Is
all
mayonnaise
the
one of them?
that tastes really nice.
Yeah, yeah, all the good stuff. Pate. I remember
Yeah,
my best mate Kim.
yeah,
All she craved was pate when she was pregnant, but she was never
yeah.
allowed to eat it. She'd be like, "Oh, I can't wait to get this baby out and
Christmas,
have pate on toast."
yeah, Christmas when you're pregnant is like pate, cheeses, alcohol, mayonnaise, raw egg. Yeah, it's like all stuff like that. It's all the best stuff.
All the good stuff. Did you
Yeah.
experience any cravings when you were pregnant?
Oh, see, look, I was obviously a really boring pregnant person. I think I had about a week where I was like, oh, really juicy apples would be nice, but that was about it really. Again, like the lack of symptoms drove me crazy. I wanted to wake up at midnight and say, Simon, go and get me some olives or something, but it just didn't happen.
Oh, there you go. I remember one of my friends, Emily, when she was pregnant with my goddaughter, she never doesn't like nuts at all, but all she ate was salted peanuts because she was craving them
Oh,
so bad when she was pregnant. But there was some information in some of the studies saying that part of your nutrition and cravings is your body telling you that you need something. So in that instance, it would be sodium. But yeah, so I think that can be easily mistaken for, oh, the baby wants a
yeah,
galaxy.
yeah, yeah. I did a lot of that, but I wouldn't necessarily say it
Yeah.
was.
Was your excuse me, was your mindset around food affected by being pregnant? Did you worry at all about what choices you were making with your foods and in terms of how you were giving nutrients to your baby?
Mm. For me, it was probably more guilt side of things. Whereas, normally I would eat really well in the week and at the weekend think, if I want to have like not a cheat meal, but if I wanted to have something that wasn't strictly on plan, then I'd be happy to do it. But then with that pregnancy, I was like, sometimes if we would have a takeaway or something, I'd find myself apologizing to the bump and say, like, I'll be better next week, I promise. So it was almost like with the junk food and stuff, I actually did feel a lot of guilt. But at the same time, I had to reason with myself that, I'm doing all this exercise, I'm really active, I'm eating well, like 90% of the time. It doesn't matter if I go to the McDonald's drive-through now and then. But yeah, it was guilt more than anything rather than a worry, I think.
Yeah, and I think even if you're not pregnant, uh, a balanced lifestyle, sometimes if you're like you say, have a background like us, can be a little bit difficult to navigate with your mindset and feeling
Yeah.
guilty. But 100% balanced diet is the way forward.
Yeah.
Um, let's get on to the birth. So I
Need
know
to
you
get
probably don't want to relive this at all, but
no.
I think it's important we talk about it because going back to what I said earlier about how you can train, you can be as healthy as possible, and it won't guarantee that you have a smooth birth or
Mm,
an easy birth. And I think obviously that does apply to you. So
yeah.
I'll leave it in your hands to discuss how it all
Okay.
came about.
And I almost had like a little bit of an anxiety that I'll tell my story and people will be like, oh, there you go, as proof that you shouldn't, you know,
Yeah.
be overexerted, whatever. But it's completely not linked in any way. So yeah, I went to a 34-week midwife appointment, feeling completely well, like fresh out of the gym the day before, like no symptoms, feeling good, like working and everything. Um, and they were concerned about some of the test results they had. So they wanted me to whip to the hospital, so kind of went up. And went from like a checkup at the hospital, went to a whole day, blood tests and things. And the doctor wanted to give us the results of the blood test. And I feel like when they asked the doctor to do it, this probably isn't going to be the best news. So the doctor took us into a side room and he said, you're severely preeclamptic. That can be really dangerous. And the cure for preeclampsia is delivering your baby. So the good news, so they said, the good news would be that we hopefully can have her delivered in 48 hours. If it's bad news, it'll be 24 hours. So that was a massive shock. So I had my work clothes on, I had my lanyard in my hand, but I was admitted to hospital straight away. Within a couple of hours, I was given steroid injections to fast track the development of the baby's lungs and heart. And then a couple of hours after that, I was given a guided tour of the special care baby unit. So it was a really full on day. I won't get emotional, I promise I won't get emotional.
Because you'll get
But
me
I think,
emotional.
oh God, you don't talk about it from start to end very often. So it is tricky to talk about. But the thing with preeclampsia is nothing is really known about what causes it at all. They know it's a problem with the placenta, and it's to do with blood pressure. Now, luckily for me, I was active, I was exercising. Exercise helps you with your blood pressure. It helps, with healthy, keeping your blood vessels and, everything cardiac all healthy. So in that respect, I think I was really lucky, and probably why I literally did not feel ill at all. And I think that's what was so difficult about being admitted to hospital. I was arguing with them and saying, like, I'm fine. I feel fine. With preeclampsia, 1 to 2% of women get it severely, like me. And the outcome, the reason it's so dangerous is it can lead to eclamptic fits, which can be fatal for mother and baby. So
Wow.
that's why they take it so seriously. But for example, people who usually get preeclampsia are over 40, have a BMI of over 35, they're having multiple births, like all these things that just don't describe me at all. And one of them is that it can be like historical in your family. And for me, that's not actually a definite. So I don't know, completely know whether that's the case or not. So it was really a complete fluke. There was nothing that brought it on, which I think is really important to emphasize, that I, you know, maybe if I hadn't have kept myself so fit, it might have happened sooner. So yeah, I was told I was severely preeclamptic and the baby would potentially come within 24 hours, and they did a lot to kind of prepare us and prepare her for the fact that was going to happen. Then they decided to induce me. They asked us to choose, would you like to be induced or would you like to have a cesarean? And we weren't ready to have that conversation, so we quickly did a little bit of research to find out, and we kind of thought, well, maybe inducing would mean she would have a bit more time in my tummy and, you know, she could get a bit bigger. But up until then, again, I was feeling perfectly healthy. I just felt like a fraud sat in this hospital bed. But the minute they induced me, for some reason, it seemed to act as like a catalyst for the preeclampsia, and I became very, very poorly very quickly, to the point where it was unmanageable for them. They couldn't, you know, a lot of my levels were really, really high. Some of it, like liver levels and things, should be at 100, but mine were over 1,000. So it was really like my health completely plummeted, and I was getting near that point where I could have been having these eclamptic fits that they were talking about. So they decided to do an emergency cesarean. And that was actually the calmest point of the whole experience. So if you're going to have a cesarean, don't fret about it, because for me, it was so chilled out. It was really a really lovely experience. Everyone was really friendly. I looked miserable. I think they were trying to be so lovely, and I was just like, what's going on? But it was really quick and it was really seamless. But the thing with 34-week-old babies is it's like a funny prematurity. If they were 30 weeks, they would know for sure that they would have, you know, problems with breathing, maybe with their heart and things like that. And if they were 36 weeks, they would know, like, you were nearly a full-term baby, you don't need any help. So when she was born, they didn't know, they couldn't tell us if there would be anything wrong with her. So basically they kind of whipped her out, and they gave us, I've got a photo of us holding her for the first time, but that was literally a 30-second hold, because they gave us, we snapped a picture and they shot her away. And then she was taken out of the room down to the special care baby unit, and my partner went with, and I was left there just on my Todd, being sewn up with these people. And I didn't get to see her. So that was 10 in the morning. So I didn't get to see her again until about 5 in the evening, because my health just wouldn't sort itself out. So once they kind of got me stable and things, then they took me down, and they, I got to see her for the first time. What was really interesting, so part of, like I said, part of preeclampsia is the fact that you have problems with your blood pressure and regulating it. And one of the nurses said she was amazed, because, you know, there's always talk about this bond between mother and baby and how it can overcome so much. And she said that when they put the baby on my skin for the first time, my blood pressure shot right back up where it should be. So like just that first contact, which is amazing. But yeah, so she was phenomenal. So she was £4.12, which is really diddy. But she didn't need any oxygen, and she didn't need any help with her temperature. She didn't have jaundice or anything like that. She was just literally a very teeny tiny baby that needed to get fatter. So we stayed in the hospital in the special care unit for 2 weeks. My health was a bit more challenging, but after a week or so, I was discharged. But then I stayed in the hospital with her until we could come home. So yeah, it wasn't what we expected. at all. And for someone who worked really hard to try and keep myself like fit and active and like give my body everything you needed, just the universe had completely different plans, which was hard. But we're here a year on, and it's not, it's fine. It's all good.
There you go. I mean, wow, what a way to come into the world, Molly. What a story for mum to tell.
I know, exactly. And she hasn't stopped since.
But how does it feel to be in that 1 to 2% of women with Beyonce nose?
I mean, yeah, I feel pretty special, to be fair.
You two are pretty much the
If
same
Beyonce
human.
can do it, I can do it too.
Yeah. Oh, I would, yeah, love to be in the top 1%, but
For
preferably not for
anything, like for anything.
preeclampsia. But so a pretty traumatic birth and experience for both you and Molly. But what I want to talk about is how strong Molly was, even as a premature baby. Like, she was so strong, wasn't she?
Yeah, yeah. She really was. And they would say, like, even like prem babies are, you think newborn babies are sleepy because, they're just out of the womb, like, they need their rest. But prem, like, I really noticed with her that she wasn't ready to be born yet. She didn't cry for the first 6 weeks just because she was still like in womb mode. But if we were to hold her, she would be trying to lift her head and things. And you think, hang on a minute, you're not supposed to be here yet. Like, calm yourself down. And yeah, she didn't need anything apart from getting fatter. And we shared the ward with some lovely people whose babies were poorlier than Molly, or had been born much earlier. So we thank ourselves so lucky. One night I was in there, on my own, and about 2 a.m, these premature twins got rushed in, like literally freshly delivered twins, and you could hear all of the nurses and everybody, like all the staff, just rushed and were working on them to try and make things right. So it just we just feel so lucky that despite all of that, she, little tough cookie, she didn't need anything.
Yeah, and I think, I obviously we can't say for sure it's the reason, but I'm sure one of the reasons that she was so strong was because you were so strong and fit and healthy because of your routine and your training and nutrition.
I hope so.
I
I hope
reckon
it will waste.
because she's a body pump baby, even though she was
Yeah,
premature, she was in
yeah,
team lean with Leanne all the way.
yeah.
Despite having a premature baby and a very traumatic birthing experience, do you think that one of the reasons that you recovered so quickly and why Molly was so strong was obviously because you trained and exercised? I guess you've already answered that, but let's ask it again.
Yeah. No, I do. I mean, like, again, like you're saying, we don't know for sure that that's, why Molly was, so well when she was born. I like to think it was the case. But I definitely think for me, the preeclampsia, I almost feel like I need to take that off the table completely. And if you think about my health aside of that and recovering from the cesarean and getting back into a normal way of life, that for me was really quite easy. And I do think it's, because of the choices that I made kind of in the lead up.
Yeah, 100%. How this is potentially quite a tough question. How was your mental health impacted due to that birthing experience? Because it's obviously a ridiculously traumatic event.
Yeah, it was broken is the best way that I can describe it. So, there's the birth itself and then the experience after. I mean, just, having her being premature and that long hospital stay, I stayed in the hospital for 2 weeks. I didn't have to. I could have left if I wanted and, coming back and forth every day, but I didn't. So I was
You
there on
could have
my
left her there.
yeah.
Yeah, that's
And people did that. That was actually quite normal. I was an anomaly. Like, I was one of the people, one of the abnormal people that I lived there. I didn't leave. I left once to wash my hair, cried the whole way there and the whole way back, and then came home again, back to the hospital. But I was there all day by myself. It's limited visitors because it's a special care baby unit. They can't just have people like coming in and out with all these vulnerable babies. So that it was a really lonely time. And I think for me, the thing that was the hardest was the fact that she was born prematurely because of my body, and that my body failed her, and
Han.
that could have a potential impact on her life because my body couldn't do the job that it was supposed to do. And that's something that I find really difficult. And that's, even now is something I find really hard. I couldn't even give birth. Someone else had to do it for me. So I think just how it all came about was really difficult. And the fact that, she's doing well now, but when she goes to school, or, we don't know what impact that delay, like 6 week early start, will have on her. And no matter how much people tell me, in my mind, it is purely because my body failed, that she came early. So that is really difficult. And I think, anyone with traumatic birth it's going to have a massive knock-on effect on your mental health. And whilst I was in the hospital, the nursing team were amazing. They referred me to the perinatal health team. Perinatal mental health team. They referred me 3 times because the concern was growing and growing. And it was on the 3rd time that they picked me up. And they referred me and offered me support through like a perimental health practitioner, who then actually passed me on to a charity called Little Bluebells, which was phenomenal. And it's something you can go online and have a look at. And it's about promoting the mental health and emotional well-being of like pregnant and new mums. But the problem was that COVID hit at that time. So I couldn't properly access the service as I needed to, but we still kind of made it work. So it was a huge hit on my mental health, and it still is. But the team in the hospital were really good at spotting that. I mean, it wasn't hard because I was just crying over my baby all day, every day. So it was pretty obvious that there was something wrong. But so the support is there. And I think at the time, it was obvious why. I just said, I just need to go home. That'll make me better. Just, let us go home, and kind of arguing with the doctors, because being there in that situation, I felt was the only reason I was struggling. But I think now there's so much more to it. So it did have a massive impact.
I have to say,
apologies for the ugly cry
no,
face.
don't apologise. I have to say a massive thank you for you being so honest about that, because I think so many mums will suffer with some sort of maybe postnatal depression or guilt, or even like I've heard about people grieving for their bump. I think Stacey Solomon talked about it actually, about how she was really depressed that she didn't have a bump anymore, and all of these facets of mental health that are included in pregnancy, let alone real life. And then you throw COVID in the mix, Hannah.
And that in itself has added like a whole, that it's so challenging as a new mum. You can't even begin to describe. Like, there's a whole new process of like mourning and isolation, and it's really difficult. But even as your baby's getting older, sometimes I think I can't remember her as a newborn, and I try and sit there and think, come on, what did she look like? What did she do? And I think as those memories phase, when you reach a new like point in their milestones, you can't help but grieve what's gone. So it's a never-ending emotional roller coaster.
You're selling motherhood to me. I love it. She makes me broody every day. So how long after you gave birth did you return to exercise, and what was that like? So typically they say, don't they, a minimum of 6 weeks of not returning to training. But again, I'd always say do the 6 weeks, and then your body the best. If you still feel like you're recovering, wait. But if you feel okay, then crack on. Was yours longer than that because you had a C-section?
So the advice I was given, and actually no one tells you when they cut you open, sew you back up, and then send you home. It's only really like when you have your postnatal checkup. So if you weren't someone who looked into it, you could have done a bit of damage before then. But 8 weeks. So I waited until the 8-week point, and at that point you should have like a postnatal checkup with your GP. So at that point she kind of checked over my scar site and just talked about my health in general and things like that. And I started like the day after my 8-week checkup, because I had felt ready for quite a long time. As I said, my recovery had gone really well. So I thought, right, first workout, I'm going to do a Leanne Zumba. Like, this will get me back into it. Nearly vomed. I was the wrong workout. And again, you've got those expectations of, I'll just pick up where I left off, but that wasn't the case. So for me, it was all about like walking, getting the miles in, getting the steps in, which was really enjoyable. Yeah, a little bit of running, but I'm not really a running pro, but it was just nice to be out and about. And by then, lockdown had happened. And at the same time, you had just started one of your 8-week challenges, which is an absolute godsend. So I thought, right, I'll use this as a way of easing me back in. So I think a lot of people were using it as like body transformations, things like that. But for me, it was just like, right, I just need to use it as a way of getting back into my workout routine. So it was a lot of home workouts. It was a lot of like Lean with Leanne live workouts. And that was just good for me because I could take it at my own pace. And it went really well. One thing could be TMI for anyone watching that has baby and not have baby. I didn't get told that when you have a cesarean, you still have a significant amount of like postpartum bleeding, which I didn't know. So I think one of the things that I really noticed is come the 8-week mark that had stopped, but if I exercised too hard, it started it all over again. And it was like my body's way of telling me, you're doing too much or you need to slow down. And yeah, as after having, for some reason, I think I was naive and thinking, oh, that's only a side effect of a natural birth. I don't know why I thought that.
I would have thought that.
Yeah, but no, it was the case with the C-section. And I know people who had C-sections and even like 12 weeks onwards were still having those kind of like side effects. But for me, I did really notice that if I walked too far or did a crazy Zumba when I wasn't quite ready, then it would almost like start that like bleeding cycle up again. So I think that's a really good, for me, it was a good sign of, oh, you need to slow it down a bit.
Yeah. And I think it, people underestimate things like walking with the pram and stuff. And I think easing yourself back in, that is one of the easiest ways you can start being more active and doing it with your baby as well. And I remember you always used to walk the pram along the seafront with little Molly. You still do it now, don't you?
Yeah, why not? But like, for example, Molly was a colicky baby, which is, she only had it for a short period of time, but it's horrible. But being in the pram was one thing that really soothed her. Or, I used to try tie nap time in with the pram walk. So, that's a really easy thing to slot into your like new routine.
Easiest way to keep active. Did you have to change any of your training when you came back because of your C-section?
Not really. Again, I was really lucky that the C-section was quite like seamless and the recovery was good. The only thing that I noticed, and actually I still notice, well, when we're allowed in the gym, I still notice now that, say if I've got the bar and I'm doing hip thrust, so the bar's like resting on like pelvic area, that kind of really aggravates the nerve endings in my scar site. But I don't have any, ab workout, anything like that. It's not really any different for me. But maybe again, I was just lucky, or that's not been the case really.
Yeah, I've had quite a few clients who have had C-sections that feel a little bit of pressure when they lay face down on the lying leg curl and they're trying to lift a weight, or if they're doing barbell hip thrust. So it may just be something that people just need to be aware of moving forward. Like I say, for the millionth time, you know your own body. And if something doesn't feel right, then stop and we'll adjust it. How has it been trying to fit an exercise and healthy eating routine into your life with a newborn baby?
Well, my newborn baby life was tied up with lockdown. So at some points, newborns, they're exhausting because you're up all night, but they sleep all day. So I found that to get me out of like the lockdown lows and like make sure I didn't kind of dip into the the baby blues, I found actually the exercise and routine and stuff was a really good focus for me, because I kind of made it a part of our little routine. So in the mornings I would know that between 9 and 11 she would be out like a light, and that gave me enough time to like have breakfast, do a home workout, have a shower, and then like prep my lunch or something. And then, all the other naps and things in the day, that's when I can take it easy and watch, Housewives of LA or whatever.
Yes.
But I just found that in those, even with lockdown or without lockdown, you know, newborn life, it can become a bit of Groundhog Day. And I think, you know, your baby's so little, you're not necessarily getting that response from them yet, and that can be really hard. So I think to counteract that, I did kind of find it easy and useful to drop the exercise and things like that into my routine. So I didn't find it too difficult. And I think for me, it was just trying not to put too much pressure on myself. So if I didn't feel like doing it, or she was being fussy, I wasn't going to like pull myself over the coals for it. Just, you know, maybe we'd go out for a walk, or maybe we just would just snuggle on the sofa, because actually that's just as important too.
Yeah, 100%. And really, when your baby is newborn, and probably until they're 18, they are the number one priority, aren't they? Like, you are obviously still important and should commit to doing these things for yourself, but you got to realize and take the pressure off yourself, because the priority is still you providing the baby with its nutrients and love and attention. And you should just enjoy being a mum as well, and not feel that pressure to have to get straight back into an exercise routine. Now she's 1, what does training with a 1-year-old look like? And let me just say, I love it when I'm Zumbaing here in my dining room and I just see a baby walker come across in Molly's face.
Now just her like darting across the room. She gets so excited because of lockdown. She just doesn't really see people, so to have all these dancing faces on the TV, she just loves it. It is a lot harder with a 1-year-old. You know, she naps less, she's awake more. If I take my eyes off her for a second, she's like digging her hands into the cat food bowl. So it's really hard to try and like say, right, at this time I'm going to do this. It is really difficult. But I kind of use my exercise and stuff more as like me time. So when my other half gets home, I'll say, right, I'm going for a run, you can take over. So I find it, you know, if you're on your own, that might be a little bit more difficult. But I find for me, we kind of do a bit of a tag team in that respect. And I utilize like a lot of the evenings and weekends and stuff like that. And again, you know, even though she's bigger, she loves a little pram walk. And, you know, sometimes we might go, you know, Paynton to Torquay and back, and that might be like a 6-miler. So it doesn't have to be, you know, a full-on crazy Zumba workout. But it is a lot harder now that she's more into everything.
Bless her. But she's walking now, so it's only a matter of time before she can start Zumbaing.
Yeah, that is true. That is true. She loves it too. She gets a little dance on as well, like when you play music.
Oh, I love her. She's so cute. Do you ever struggle to balance being a mum? Now you're also back at work, you are a partner, and keeping active, or have you found like a way to incorporate all of them in a balanced way?
Yeah, I think, you know, like I was saying before, that you know, it might not be everyone's thing, but my me time, I prefer to use it in that way. So, you know, it is really tricky now. I find I'm apologising to you all the time, because I think, oh Leanne, I can't make the live tonight because I'm at work and I've got to come home and do her dinner, and then it's our dinner, and it's just like too much for my brain to handle.
Yeah.
But so I try and kind of do my own thing, like when she's in bed or at the weekends, and I use it as that time that I've set aside for myself, because it makes me feel really positive. I feel like I've been productive, and, you know, I get that good feeling from it. So it is really hard to get the balance, and I might not be able to kind of log in or get online when everybody else is, but I find ways of doing it in my own time. I think I would really notice if I wasn't able to, you know, fit it into my week.
And I think that's really important as well, is finding time to do it, but in your own time. It doesn't have to be on anyone else's schedule. It should always be what is best for you, what is best for your child's routine. You know, it should not come at the expense of you spending time with your family, etc. And I think you found such a good balance with that. And I know having just returned to work, that must have been something that was quite hard to navigate at first. But I think it's really important that mums don't feel the pressure to try and do everything all at once and be everybody's everything.
Yeah.
Which brings me to a nice rounded way to end this lovely podcast in asking you, what would your advice be for anybody newly pregnant and wanting to be active?
I think at the beginning we talked a lot about that first trimester, and I think that's the trickiest part. I would say don't sit at home and and ah or worry, or I would just get in contact with someone as soon as you can, even if you think it's too early. get in contact with your GP or your midwife or a personal trainer or someone you trust that works at the gym and talk to them about it. Because the minute that you do, you'll feel, you know, so much more relieved and so much more confident in getting out there and getting active. And once you feel the benefit of getting yourself moving, I think it'll far outweigh any of the worries that you had initially. So I would just say, don't keep it to yourself and you know, stress yourself out about it. Talk to someone about it, because you'll feel so much better in the long run.
Love that. And then my final question for you, Hannah, is what would your advice be for any new mums who are worried about their body image?
I was going to say a swear word then, but I won't.
Go on, swear.
I just think that your body has just done something unbelievable. You know, your body has grown this little human being and birthed them, and you did that all by yourself. And this little baby, they're not going to care if your boobs are a bit saggy or you've got some stretch marks or you've got a muffin top, because they are just completely doted and loving you for you, because you know you're their mummy, and it doesn't matter to them. So I don't think it should matter to you too. I just think you need to give yourself a little bit of credit, and that time will come. But if that time's not now, then that doesn't matter, because you've got, you know, so much more important things lying there in your little arms. Yeah.
Love
Give
that.
yourself, I feel.
And talking about giving yourself a little bit of credit, that brings me on to my final statement of the day, which is I have to give Hannah and Simon a huge shout out, because I can't imagine how difficult it is being new parents, but being new parents and navigating that in a lockdown with a pandemic where you can't go and see anyone, you haven't been able to spend time with your family with a newborn baby, and Simon's still been working and you've been on your own with the baby. You are an amazing, amazing mum. And she is the most perfect little girl in the whole wide world. And she is just so strong and gorgeous and healthy. And you should give yourself some credit, because she is just the luscious little thing I've ever seen. And yeah, shout out to Molly Moo.
Thank you.
And
She
to
is
Simon, yeah.
It's not easy, but is it easy for anybody? I don't know. It's not, is it? But it's all very, very worthwhile.
Yeah, and
but COVID can just do one, and then we can start living life properly, which would be lovely.
I know, and we need to have like a belated birthday party for her, don't we? We'll set up the soft play in the studio.
I would still like a baby shower. That would be lovely.
But yeah.
Premature birth and all that ruined all my plans. I've still got antenatal classes to finish, actually. That's how
There you go. Thank you so much for joining me on my podcast today and being so open and honest about your experience with birth and mental health and physical health during and post-pregnancy. I know it's going to really help a lot of people listening to this podcast hear your side. So thank you so much. And massive thank you to everybody for joining us for Confessions of a Diet Queen episode 4. Next week I have another really incredible guest who I'm really excited to let you know next week. And don't forget to give me a little review on Apple iTunes or Spotify, and you can watch this on YouTube as well. Thank you and good night.
Thank you.